It is important to keep in mind, doctors say virus mutations and variants are common. The question is, will 2 doses of a COVID-19 vaccine be enough? ABC 10 News reporter Jared Aarons takes an in-depth look at the possibility of the need for a COVID booster shot and why local doctors think it's a matter of when, not if.
We call it the immune correlate of protection, and we just don't know yet.
UC San Diego Chief of Infectious Diseases, Dr. Davy Smith, says the need for a COVID-19 booster all depends on how strong the initial immune response is and when that protection wears off. But because the vaccine has only been around for a few months, that's something researchers are still working to find out.
We follow a whole bunch of people who got a vaccine. We measure their immune responses, both the T cells and the antibody levels. And then we look and see how often people are getting infected over time.
In separate interviews last month, the heads of both Pfizer and Moderna said we'll probably need booster shots, but they didn't say when. Current studies show the vaccines offer protection for at least 6 months. Research beyond that is still ongoing.
Once we start seeing more infections below a certain level, then we're like, okay, so if somebody has this level of antibody and it dips below that, then perhaps we need a booster at that point.
But protection and immunity is only part of the issue. As the disease mutates, new variants could be able to resist the vaccine, making booster shots a necessity.
It's a matter of when, it's not a matter of if. It will eventually successfully evade our immune system to make our current vaccine less protective.
Dr. Hai Xiao, the infectious disease specialist at Sharp Chula Vista, says the longer the pandemic lasts, the more likely that becomes. He says that makes COVID-19 similar to the flu, where a yearly shot targeting specific variants could be necessary.
If we have a mixture of these variants simultaneously circulating in the community, then we could potentially down the road, as example, have multiple antibody generating vaccines mixed together to make sure that we cover all the variants.
But COVID boosters may be months, if not years away. That's why both Dr. Xiao and Dr. Smith say the focus needs to stay on getting people their first or second shot now and working towards herd immunity.
When you get a vaccine, you're protecting your community. And I really want to get that message out.
Jared Aarons, ABC 10 News.
Now, officially, the CDC says the need for booster shots has not been established, so they're not recommending them right now. Now, if you have a story that needs an in-depth look, we'd love to hear from you. Just send us an email to that address, tips@10news.com.